Hey everyone, this is Steve. I thought I would just do maybe a little rehash of Bloom's taxonomy with a little bit of information or maybe practice with the ABCD stuff for the objectives. I'm doing this because we didn't have great scores on the last quiz. And I think some of that is Trevor and I went over them a little bit, and it might be a little bit of the quiz. I had to do a little bit of investigation today, and I guess there are all right, but they're questions that I don't like too much. So I kind of wanted to say don't beat up yourself too bad if you didn't do great on the quiz. And this is a bit of a benefit for the two people who still have to take the quiz. So what we're going to do is go over the three domains, talk a little bit about each of them, and see where we are in maybe how we're going to be able to get all the questions right on future quizzes and tests. And again, the number one way to do this is to make your cheat codes using things like NAPME, ESAC, and cover. Hopefully you know what I'm saying when I talk about it in that way. Write those out, write out the words, and then have maybe a good understanding of what those actually mean. Our next step is we should be writing quiz questions or test questions for these also. So here we start at the bottom of the cognitive domain with knowledge. And so here the student should just be able to recall facts. So let's look at an objective then. Given a list of common medications, the paramedic student will identify the correct medication with 90% accuracy. So it's basically just remembering stuff. Things like which of the following would you use for anaphylaxis? And be able to point out, oop, epinephrine goes there. Which of the following do you use for a narcotics overdose? Okay, boom, naloxone. The person just understands that and that alone. So this slide also brings up a little bit of this is everything is AI on this PowerPoint. I asked it. All of it pretty much chat GPT. I tried to use Canva and it was not too good. So when you use chat GPT, a lot of times they will talk about the mistakes and hallucinations. And here's a great one. You'll see because chat wants to do things quickly, by default, it will very often do really well for a bit and then start to hurry through things. And here you can see like the epi injection, one of those, the label's on upside down. And then when you get to the bottom, it's not spelling amiodarone or ondansetron. I think that one is supposed to be atropine sulfate. And then the other amiodarone is spelled correctly and it has the right dosage there too. It's like an accurate bottle. I guess you'd say kind of accurate anyways. The and I think that's about it. So when you're using AI to build PowerPoints, what I would suggest is ask it to do minimal stuff at first. Like at first you could maybe come up with an outline and then break that outline down and maybe ask it to make slides, which usually I don't find that ChatGPT and Canva, they don't help you too much with making slides. It's you end up having to conform to their slides. So it's probably best for you to make your slides the way you want to, and then the way that you can use AI to help you is to create graphics and pictures and tables and things of that sort. So in the cognitive domain, the next one up is going to be comprehension. And this one, comprehension and knowledge, they're very close together. We're splitting hairs to a great degree. Again, very often in your career, you'll just have to know these as C1, C2, and C3. And C1 is going to be knowledge or understanding is the other blooms, and then comprehension. So comprehension then is they really kind of understand it. They're not able to just point or list or pick out or match. Now they're able to actually kind of talk about it. Use their own words is the big part here. That is very often what you'll see. Like they can use their own words in describing something. Very often it's going to be like the short fill in the blank kind of workbook in things. You're probably above knowledge when you're using just fill in the blanks kind of stuff. So here in the, we're going to break down some of the objectives. I would like you to read through all of these objectives, and I've put the ABCDs in all of these. And so here, given a cardiac scenario, that's your condition, that's where what your environment looks like. The student, that's your audience, will explain the likely pathophysiology. So I think that whole thing is the behavior will explain the likely pathophysiology with accurate reasoning. All right, and now this is a weird letter D. So what does D stand for? Think about it for a little bit. Degree. So degree, this one's a weird degree. It's accurate reasoning. So what is your definition of accurate? So it's not the best of the degrees. Again, I'm just using what AI gave us. I thought we could go through that quite a bit and have maybe a little discussion if we need to. So again, comprehension, a lot like knowledge, but now it's sticking with the student a little bit. They get it. Um, uh, Not only is it going to point to a bone, they can describe it. All right. And here, application, where we want all of the students to at least be, and you'd say at least. So here they're able to use the information that you've given them. So basically they're running scenarios, all right? And the scenario isn't exactly like the one they just ran, all right? So that's very often what we're going to be dealing with. And so an example here for your objective is during a simulated call, obviously that is your condition, that's the condition in which the student is performing. The student, obviously the audience, will correctly apply a cardiac arrest protocol. So that whole thing is the behavior, correctly apply a cardiac arrest protocol, and then with 100% of steps. So 100% of steps. I don't know if I like that one that well, but it kind of makes sense. It's what AI would say. So application then is when the student finally do the things that you've been teaching them. So they're doing what you want them to do. All right. Not in complicated situations or anything, but they're able to run a cardiac arrest. They're able to run an asthma patient. They're able to control a scene. They're able to do whatever thing that you're talking about. They are able to apply that information and actually to us in the EMS, that usually means we're running scenarios. And now when we get to analysis, it gets a little confusing. This is where they're breaking down the parts of the information. So I like to say that now they understand all of the why. So once we're at analysis, we understand why we're doing things too. So why and analysis kind of go together for me. And then I've already said compare and contrast is a big deal here too. But ultimately what they're able to do is break down all of the parts of the scenario that you're basically being given, and they're able to then maybe prioritize what's most important about this patient, maybe be able to compare it to other patients. It's when you're able to ask questions of like, how are asthma patients and trauma patients treated the same? How are they treated differently? Why are they treated differently? Things of that sort. So this is when you're watching the students and kind of gearing how they're doing. When they're above application, this is where they're saying, wait, what did you, now you're saying something is different than what we've learned before. And they tried to formulate that in their brain that, oh, this person may not need oxygen as much as the other people need oxygen, or maybe we have to be more careful administering oxygen because it does this, or because this patient has a propensity to have hypoxic um, hypoxic breathing. So the which I don't like to talk about hypoxic breathing too much. I think it's kind of overstated. And that is the analysis. All right, it's the beginning of critical thinking, and it's kind of where we want them to be at. All right, we kind of need new paramedics to be able to critically think their way through calls. And then we're at synthesis, above where we usually are. But synthesis, truly, that's kind of where we want people to be at, because um, if we're creating action plans or patient treatment plans, then we're at the synthesis level. So usually when we're testing people, we don't have them doing an actual creation of a patient care plan. We're having them choose between different ones. So that's usually thought to be analysis level when you're asking the more difficult questions. To be a synthesis, to me, in a written format anyways, you probably have an essay test for them. And so here for an example, it says, given a complex scenario, the student will develop a complete treatment plan with minimal instructor prompts. So here, I wanted to keep this one because I kind of don't really agree with their degree. I like the condition, maybe given a complex scenario, the student will develop a complete treatment plan. Boom, I get all of those. But then with minimal instructor prompts, that seems like a condition, like you're in an environment where the instructor's not prompting you. Um, so it could be the way the person is, and the way AI is writing this is with minimal instructor prompts means, if you're following skill sheets, when you're prompting people, um, you're you're subtracting. Usually you could give them a 2 without prompts and a 1 when you do prompt them, and so you're looking at a skill sheet. But this is kind of hard to. We're in the cognitive domain and not a psychomotor domain, so that doesn't work that well. Just thought I'd throw that out there. Hopefully I'm not confusing you too much. Remember, the C is a condition. It's the environment in which the person is working, all right, or being tested. And then the degree is the degree in which they have to perform, which is usually quantitative, and it's going to be something like 80%, 90%, 100% accuracy. Maybe it's a time bound thing, so within 30 seconds or 30 seconds or 3 minutes, whatever it would be. And then at evaluation, here we're judging and critiquing. Here, to me, that means you probably have one student critiquing the performance of another student. Could be other things. It's not just correcting papers. After scenario, the student will critique their team performance, giving 3 accurate improvement points. So I can see where that 3 accurate improvement points, that would be the degree to which they're doing that. You could grade that, right? So it has an ABCD. It's also pretty specific and smart. So now we go over to the psychomotor, and we are basically at the bottom. Remember, this is NAP-ME. So if you haven't figured out NAP-ME right now, let's just stop the video for a second and write out NAP-ME and see if you can come up with that. We're going to do imitation, and then manipulation, and then precision, articulation, and naturalization. So here for the imitation, it's pretty easy, monkey see, monkey do kind of stuff. For the objective here, I said given a demonstration of a BVM setup, so they have a BVM set up in front of them, the EMT student will imitate, pretty easy action verb there, proper assembly with 100% accuracy. And there's your objective. At the next level now, the person is basically practicing and performing it with minimal interference, but they do usually have supervision at this level. This is where you want to make sure that the student doesn't build bad habits. So that's about all you have to do. This is when they start to put in their own little, what do they call that? Their own little flair. So, and they're basically practicing. They usually have their skill sheet out still. And you should expect them to make mistakes, and you should be expecting to give them some coaching while they're doing the skill or right after the skill. So here for the thing is given verbal instruction, that's just this condition, I guess. The student will assemble a needle decompression kit under 45 seconds. So there we go. And then they're basically able to follow directions here. All right. Put in an airway, do this, do that, and they're able to do that. Again, they like to use skill sheets. They're practicing. They're building their technique. And at precision, where we need them to be minimally, is they're able to perform the skill. So the way that this is defined is they're able to perform the skill without error. That doesn't mean they never make an error. It means they can do the skill without error. Sometimes when they do the skill, they do have an error, but they predictably can just do the skill and not make an error. So here during this airway lab, the student will insert an OPA without causing trauma. That's good, 4 out of 4 attempts. And then precision here, it says because close enough doesn't cut it with the airways. Yeah, I think that's an okay objective there. And articulation. Here, when you articulate something, you're talking. So very often, for me anyways, I liked the way that this was explained once a long time ago. It's not explained this way in our curriculum, so I kind of hesitate talking about it this way. But at articulation level, while you're doing the skill, you're usually thinking about the skill, and you can talk about the skill. Something that's remarkable is during training, some people will be at a level where they can do a skill but not talk about it at the same time. They're thinking about it too much to be able to actually do the skill and talk at the same time. So while they're doing the skill, if you talk to them as an instructor, ask them questions about the skill even, they'll stop doing the skill, answer your question, and then go back to the skill. And you can talk to them and say, hey, do the skill while you're talking to me. And you can see that they become more nervous, or they basically say no, or they start making mistakes, whatever it would be. What you would really want everybody to be at least at the articulation level. That would be a good class. So if they have to go somewhere else to be tested, they can go back down to precision because of nerves, and they'll still pass. Precision just means you can do it without making a mistake. So here at articulation, the term that we used in the quiz was conscious multitasking. And a lot of times people put that with naturalization, which is, of course, the next one. And with naturalization, you don't have to think about it. So consciously multitasking, what they're saying is they're thinking about the skill while they're doing the skill. And they can do other things while they're doing it. They have to be conscious about doing these multiple different things. Where when you're in naturalization, you can multitask and not think about it. I hope that makes sense. I think that is just the way that it's described in the NHTSA curriculum also. I think that's about it there. Let's look at the thing I underlined here, so I might have had a problem. During trauma scenario, the student will integrate airway bleeding control and packaging with no instructor prompts. I like that with no instructor prompts. I really like that as part of the condition, but see that with no instructor prompts, scoring 85% on the skill sheet, that can all be like the letter D. That could all be a degree. No instructor prompts and 85%, that's where you are. That's the degree that you're at. But if you, I don't think I would want to sit in an argument and say, no, with no instructor prompts is a condition. That's the environment that they're at. I think that's true also. So one thing that, as we're going through this, we we have a lot of assignments where we're doing objectives and we're talking about this. But remember, we're doing this, we're having all the discussions. This is going to make it so when you're answering questions on the state's test where it's much more, I would say, black and white, those are going to be easy questions for you. And naturalization is like riding a bike there. So they're automatic, efficient, they don't think about it. All of those. Muscle memory is a big part of naturalization. And so the objective here is during simulations, that's going to be your condition. The paramedic student audience will initiate scene safety, airway checks, and assessment automatically. And then we throw in that 30 seconds. That's going to be the degree. You're timed at that point. I'm going to quickly get through these affective then. The affective is going to have its cover. Cover is going to be characterization. That's like who you are, characterizing. Organizing is, I like to put priority. You're able to prioritize stuff when you're organizing. And then valuing, that's where we need them all to be. Responding, they're actually doing what you're telling them to do. And receiving, they're just listening. So it could be that you have someone who's not even listening to you that effectively. They're pretty bad on the affective domain then. So here we very often talk about feelings here. Even when I looked at the objectives for this, there's a lot of feelings about, and there's sometimes you get thrown in here leadership and stuff, but really it is how well the person, I would guess, is able to. I think you could use the word feeling, but it's a little bit different. How the person is motivated to actually listen to you, believe you, putting forth effort to understand what you're saying. All of that is the affect of the student. So here we go with receiving. So when you're receiving, you are listening, and that is it. So during class, the student will listen to a patient narratives without interrupting 100% of the time. So those are your ABCD of the thing. All they're doing is listening here. And now responding, that could just mean that they're talking back. In a group, the student will participate in that conversation by offering two relevant insights, so we have a degree there. But responding then also is here, they are, I would say, voluntarily responding to your request. All right, so and that might be just, it's not just listening, it's participating in a conversation or doing what they're supposed to do if we're looking at an action. And then valuing is that next level where they see the value. So they're committed to it. They appreciate it. They get it. Like, okay, gloves are important here. Masks are important there. Glasses are important. Giving an empathy statement to a patient is important because it has this benefit to it. All of those things, you have that. You actually believe that something is important. So given a scenario involving a distressed patient, the paramedic will demonstrate empathy by verbally acknowledging the patient's concern in all interactions is your degree. So here we're actually doing what we're doing because we value that ideal. And then organizing is that next level. So we understand, we value the ideal, but we're also able to put it into different context or different situations and say, okay, gloves are important. Changing gloves between this patient interaction and that patient interaction are important, but I can't always do it. All right. Or using a BVM. You could say you would never use a BVM. This BVM is disposable. You'd use it on that patient and that patient only. Well, maybe in an MCI, you might have to use a BVM on two different patients. It would be a bad situation, but you would be able to say in organizing, you're able to make the right decision and not just stop and not ventilate somebody. So here, the learner integrates new values with existing beliefs and prioritizes them. And so organizing and prioritizes, very, very often you'll see that prioritization there. So during a group simulation, the EMT student will defend the importance of patient dignity by advocating for maintaining privacy in three separate situations. So that one, at that level, I think advocating and maintaining privacy. So I would think that that could be valuing. All right. So it's the importance of patient dignity and by advocating for maintaining privacy. So that's patient dignity and privacy. That's two different values. That's where you're organizing. All right. That's what the AI thing is trying to put together, anyways. But the here we're organizing when students start ranking values higher than snacks from the day room. They're trying to be funny again, but that's what organizing is you're able to embrace the idea. You value the idea of whatever you want to say, that advanced airways are important, but yet guess what? Boom, sometimes you don't do them. All right, it could be the pediatric patient who's right outside the ER, and you can get them into the pediatric ER really quickly. Maybe a BLS airway would be the way to go. And then this characterization is basically, that's how people see you. That's what I think of as it's characterizing, usually is the word that's there. The learner consistently behaves and they internalize the values. And very often what that sets is they kind of set the standard. All right, they set the standard for others in class or for the profession, whatever it would be. They're doing that. It's 100% of the time. It's very often the person is used as the example of, this guy was the best at doing this. When you say, like, I would want a fire chief that does it this way because of the way he did it, or whatever it would be.